So, I've just put up this slide just to highlight a number of things that are of interest with this disease. When you become contaminated, it can take up to 11 days or so, up to 21, but generally about 11 days for symptoms to first appear. You're not infectious in that time until you become symptomatic, and the symptoms are a fever and predominantly high temperature, really profuse tiredness, very explosive diarrhea and vomiting. It's really difficult to treat, and some other symptoms like loss of appetite and headache, etc. From first becoming symptomatic, when these symptoms appear, you can be hospitalized probably within about 5 days. And from hospitalization, if you survive past 5 days, you have a good chance of actually surviving the illness. So those first 5 days are critical. So that's just a wee bit of background on how people present. It's predominantly a disease of patients who are in their 15 to 44, with 60%, so generally fit and healthy individuals. And it's sort of evenly distributed between men and women. And the average age, as I say, is in the early 30s, 32. So, going back to this outbreak, by March, it became very clear in this area of Guinea, called the Gekadu province, that there was a serious problem, and there were voluntary service organisations like Médecins Sans Frontières on the ground at that time, and they realised that there was this unexplained disease, and they soon got samples collected and realised that they were dealing with an Ebola problem. Over time, this began to track. So the darker the area, the more people that there are infected. So by March, there was about a couple of hundred patients who had disease, and many of them dying in these early stages. And this began to spread. Over April, it was moved into the next province, and by June, it became clear that it was spreading to. This is Monrovia in Liberia, the capital, a very densely populated city in Liberia. So in June, Médecins Sans Frontières realised that they could not control this, and the organisations in the healthcare system in this area reported to the WHO that they had a serious epidemic on their hand. And to be fair, and to the credit of the WHO, since then, the WHO ignored them until about August, and by then you can see that there are many, many more cases. And as we're coming into September, we are presenting with a couple of hundred cases per week, so on a scale that hadn't been seen before. And by November, when I got to Liberia, there had been many thousands of cases in that area. And this is just a summary of the situation up until last week. There's been 28,000 cases and 11,000 deaths. So this is much better than what's happened in the past. The death rate from Ebola previously has been about 70%. So there's some encouraging news in this year that we've managed to save more people than we would have thought at the beginning of this. And many of these people died at the very beginning of this epidemic. The country that seems to have seen the worst of it so far is Sierra Leone, but the most deaths have been in Liberia, as you can see from the slide here. And it hasn't gone away, although we're not hearing any information about it at the moment. There's still cases. In the last week, there's been 2 cases in this province outside the capital of Sierra Leone, and also it's back in Guinea. It hadn't been there for a few weeks, so it hasn't gone yet. And if you cast back to the first slide, it took one person to kick off this epidemic. So we're not finished with this problem just yet, but there's an awful lot of resources now on the ground in these countries trying to come to terms with, to deal with it. So the way that you manage Ebola is that you isolate those patients that you have got it. What you do, and you try and treat them as best you can. I'll touch on that in a moment. And what you also do is you get public health message out so that you are picking people up if there's cause for concern.